Welcome to Nacho Fitness Coach. I'm Sarah, the expert.
And I'm Caleigh, the beginner.
Join us as we discuss fitness culture
from our two very different perspectives.
So grab yourself a protein shake
or a glass of wine
and let's get started. So Caleigh, we have a guest with us tonight.
We do?
We do.
Is the guest
well
here?
I mean,
is the guest here in the room with us?
She is in spirit and in voice. But no, you can't physically see her this time because I totally botched that in the last episode with Nick. It's like such a surprise that he's sitting here. Oh,
There he was.
Yeah.
I didn't know what he was here for.
This random guy just showed up. I hate it when that happens. Just people wander in.
I just roll with the punches. Whatever.
It's fine. So we have a guest tonight via phone.
Okay.
Joining us.
All right.
And do you then correctly say probably Dr. Stefanie Urbom?
I mean,
Technically? Yeah. What do your patients call you?
Stephanie or Steph. Not a whole lot of people call me doctor, but I do actually, yes, have my doctorate degree in physical therapy.
Right, which is very impressive. I just learned that tonight, and I absolutely love that. So, doctorate in physical therapy, certified lymphedema therapist.
Yes.
And your practice specializes in pelvic floor, but you're a physical therapy office. So, you do a wide range of services.
Exactly.
But the topic that has always stood out to me the most is the pelvic floor situation, because this has come up in the podcast a few times.
Every time.
Once or twice?
Between every episode it comes up, actually.
No, between every episode. How long are your episodes?
Well, they're 25-ish minutes
30,
long.
yeah.
Yeah, like 22 to 29. We try to keep them under 30.
Yeah.
So, working on season 2 here. So we've had quite a few episodes at this point. And we have this conversation.
Is that I use the restroom between every episode.
Yeah, every recording, because we, sit down, we do a few back to back. And so this comes up quite frequently about how we get done recording one and we got to have a bathroom break before we can roll. And as this started, it reminded me of listening to a presentation you did once where you kind of talked about this very topic.
I did, yes. So I think we should just start by saying, bathroom breaks are very personal things, right? So if we feel the urge to urinate, we should probably do so. But I will say,
it would be awkward to be an adult and we're peeing our pants all the time.
Right.
A little awkward.
I train people for a reason, right? But a normal voiding schedule peeing is anywhere from every 2 to 4 hours during your waking hours.
Okay, now let me just make something very clear here. I'm a stay-at-home mom. I don't go this often at home.
So I make her nervous, and apparently
Sarah makes me I'm very intimidated by Sarah.
Yeah.
This is my fault?
And worst case scenario,
the truth is coming out.
I pee my pants in front of Sarah.
No, and you're sitting on my beanbag.
Get off the beanbag before you
please don't
reveal this truth, okay? I mean, especially if it's fabric.
Can we get a towel?
Those old school leather ones.
Bring a pee pad next time.
Oh no.
No, so that's a really great point, Caleigh, because anxiety can really be a big trigger for this. So if you've already got an overactive pelvic floor and you're anxious about something, you're going to have to pee more.
Bingo.
Those muscles are, yep, exactly. So I feel like it's a normal response, a common response, but it doesn't have to be your normal.
So she just picked up on the fact that you said normal. So she's like pointing at herself like, I'm normal. I'm like, well, but then she corrected herself and said common. So don't take that normal too far, Caleigh.
Okay.
It might be common.
Common, but they are not normal. And
two things can be true at the same time.
Them. Yes, exactly.
But so you can overcome it. So we should talk about
how to
maybe
fix
some.
this.
Yeah.
But tell me this. So I have seen Sarah go up to, we've sat for like 4 hours at a time
Well, she just
recording.
said 2 to 4 hours is normal.
And she doesn't go. And she's drinking water. She's drinking wine.
Yeah.
What's wrong with her? That's not
There's
normal.
nothing wrong with her.
That is not
Yes.
normal.
Stefanie just said there's nothing wrong with me.
She said there's nothing wrong with me too.
She said,
because you guys are like on the opposite ends of the spectrum, okay? One of us goes too frequently, and one of us could probably void more frequently, and that's okay. Again, both of those things are true. But Sara knows that when she gets the signal to urinate for the first time, she doesn't have to run to the bathroom. So we usually get the urge to pee when our bladder is about half full. And then we get the second urge to pee when we're about 2/3 full. So just because we're getting the urge to urinate doesn't mean that it's a dire situation. And if we don't urinate, we're going to pee on the beanbag.
yeah, which is the situation we're trying to avoid actively.
But like this
right
goes
now.
against everything I'm like telling my 5-year-old.
Which is why, actually, since I heard her talk, as we potty trained, we kind of did a timer. But then, like, after I heard your presentation that night, Stefanie, I was like, if we're only getting in the car to go out to my parents' house, which is 10 minutes away, I've not been making my kids try. If we do like a long road trip, because I think right. if I remember right, like that was one thing that you're like, don't do that. Don't start that, because then that turns into a thing in and of itself.
Okay, but is it bad for you to empty your bladder frequently?
It is. It's interrupting the natural cycle of your bladder filling and your bladder emptying. So it's not bad for you per se, but it can lead to negative consequences down the road. So if you're constantly just in case peeing, we call it jicking. I think we talked about this last time we talked, but you're giving your bladder permission to tell you that it's okay to pee whenever you get that urge, whether or not you have a place to pee. So it can become a problem when we don't have a place. We're not. Are we at Sarah's house? When we're not at Sarah's house, we can't just pee whenever we want to pee.
Right.
That's when it becomes a problem. So just in case peeing, we try to reserve for before bed and before long car rides. And I try to be really, really clear with my patients that none of these rules are black and white, right? If you're going into a 3-hour long podcast, I'm probably going to pee before I go into that.
Right.
But if I'm running to my mom's, like Sarah said, like the kids don't need to pee.
They feel like the episodes feel like 3 hours sometimes.
They do not. Depends on how many soapboxes I get on. And Caleigh's just like zoning out.
She's over it. Like, I don't believe it. I have to pee between episodes, right? So, but the beautiful thing about pelvic floor therapy, pelvic floor health in general, like we can retrain the bladder. It is a reflex that we get. Again, we feel that sensation to pee when our bladder's about half full. So we get that reflex, and most of us are like, oh, I got to go to the bathroom, right? Like, I better go now. And while we're peeing, we are pushing our pee out. We're not just letting our bladder do its job. So our bladder and our pelvic floor are made up of 2 different kinds of muscle, and skeletal muscle versus smooth muscle. So our bladder is smooth muscle. It contracts on its own. It does not need our assistance.
Yeah.
So literally we just need to breathe and let our bladder do our job, or do its job. And part of that urinary urgency and frequency is oftentimes people aren't letting their bladder fully empty. So then we're getting the urge to pee more frequently.
Yeah.
Which is it really just ends up becoming like a lifestyle situation, really, right?
Exactly.
It's not a life or death
Caleigh,
situation, but it's just,
but Caleigh, do you know where all the bathrooms are and all the stores that you frequent?
Yep.
That look of guilt on her face is like all of a sudden,
yeah. Well, I won't go in.
That's also part of this is like, that's why I so appreciate the opportunity to be here, Sarah, because there isn't any shame involved. Like, I don't want you to feel bad, Caleigh. I want you to know that you don't have to live like this if you don't want to live like this.
Right.
There are options because you just said you could train it, right?
I think this is an intervention.
Absolutely.
Well, it might have come to that at this point, actually.
Do you guys want to read your letters now?
Yes, I do, actually. Let me get started. Dear Caleigh, I have concerns. No, I'm just kidding.
That's great.
But, I think that is the key for sure that you just mentioned was there are choices if you want to change it.
But aside from my anxiety bathroom breaks in between episodes, because honestly, that is the most frequent that I go. This podcasting, recording episodes is not we do it every couple months.
How often do you guys, okay.
Sarah has me drinking a gallon of water now. So
That's right. Water's good for you.
How dare you?
So my bathroom breaks have definitely gone up daily. Like I said, I don't feel like this is like a huge problem. What is a problem is
Oh no, I don't even know if I want to know where she's going to take this.
is the like jumping on the trampoline or running on the treadmill or running outside where I'm like, that shouldn't be happening.
Which is a whole nother
probably.
thing.
Yeah. Is it though?
Absolutely.
Is it?
Yeah.
Is it because
it is a whole nother thing, right, Stefanie?
Yeah, it absolutely is.
I feel like that's the bigger issue for me. I feel like frequency going, other than the fact that Sarah's got me on a gallon of water a day.
Again, Sarah, come on. I mean, how dare you ask someone
How dare you
to
hydrate me?
How dare I?
The audacity.
Actually, make sure your body's hydrated.
I thought I was doing really good at like 64 ounces a day. And Sarah was
You
like,
know what? It could be worse. You did a good job. I mean, that's still a good amount of water, but
I'm trying. I'm out here fighting for my life.
I'm drowning in a gallon of water. I'm peeing all the time. I'm like, you know what? It increases your steps. Yeah, exactly.
So like Stefanie, should I be, what are your thoughts on me drinking a gallon a day? Is that necessary?
Drinking a gallon of water a day. Well, I'm not going to go against your nutrition and personal trainer.
I'm not paying her.
No, right. Yeah. That's how we got the name for the podcast, Stefanie, because I was like, I'm not your fitness coach. And then it was like, all of a sudden, not your, turn into Nacho, and here we are. So,
well, I actually have been wondering, so thank you for
And we really like nachos, so.
Right. So it works.
Dave.
But yeah, no, so what's your opinion from a physical therapy that you...
So what we tell our patients, really it's more about, ideally, obviously, 64 ounces, right? I would love if my patients could get half of their body weight in ounces of water a day. So if you weigh 200 pounds, I'd like you drinking 100 ounces a day. But the most important thing for water intake or fluid intake is your urine a pale yellow? Is it close to clear? Right?
Mine is clear 85% of the time.
Except for on weekends.
And after podcast night.
Right.
We all know why. So that's my recommendation. And it's really, honestly, just like anything that I do, it's so individualized. If somebody comes in and they're drinking 40 ounces of water, it is so unrealistic of me to ask them to increase their water intake to half their body weight.
Yeah.
So it's like, okay, start drinking another glass of water a day or 4 ounces, so 64 at a minimum, ideally half of your body weight. And then, the best I would say is you're watching for urine color. So
do you consider just straight water or do you consider all fluids when you tell people that
I do consider all fluids. Now, there are bladder irritants, so caffeine and alcohol are two of our big bladder irritants. So if you're having issues with urinary urgency or frequency or leakage, we try to at least educate you on reducing those irritants. Again, I'm not really big on hey, cut this, cut that, so if someone is able to still reach their goals and not have to cut out their daily coffee, even better.
So do you have suggestions for caffeine intake, a daily caffeine intake goal?
I have suggestions.
You do or do not?
Nope, I don't. I feel like maybe you're going to school me here.
No, she's not. She's trying to prove a point. She's trying to put me in my place.
You just mentioned the irritants, and Caleigh.
Cups of coffee a day.
How many?
3.
That's not bad.
Well, I mean, 2 12 ounces. So,
that's 3. Yeah.
A total of 3.
Yeah.
So what? I'm shooting 4 cups of coffee and 1 6-ounce shot.
You are not. No,
morning.
listen. A cup of coffee is like 80 milligrams.
100.
80 to 100, depending on how many ounces and how like light or dark or whatever.
So Stefanie, what are your thoughts on me waking up and within the first 5 minutes of me being awake, shooting 400 milligrams of caffeine?
How are you shooting 400 milligrams of caffeine in the first 5 minutes that you wake up? First of all, I really
like just down the hatch, straight 6 ounces pre-workout.
It's a pre-workout.
Pre-workout. Okay.
No chaser. No chaser.
She just doesn't.
Are you chewing it?
We did find a video where there were some girls that were like literally taking the like
dry. Like I don't know what
sticks.
they call it.
What are those? What are those?
Dry shooting, I think.
Yeah, it's like a thing now all of a sudden, but it reminds me of those pixie or those sticks. Do you remember that?
Yeah, there are people that are just dry, just raw dogging their pre-workout.
Yeah, I mean, just as like a health.
They don't even lube it up first.
I feel like 400. There's so many places we can go here, you guys. Like, you're just really trying me. Is Alan dying in the corner?
As always.
Sweet Lord. Okay, yeah.
This really went off the rails.
We took a left turn.
I apologize. I apologize for myself.
I mean,
I'm here for.
I should not have been. It's my fault.
Let's rewind.
Rewind.
Let's rewind.
Forget I asked the question only because I was like, well, that's a bladder irritant. Are the 2 things that you like have in your routine? But it's fine because now we've moved on to the jumping and the running and the peeing situation. Yeah. So let's just course correct back. We'll just bring it back to that. We'll just rewind and start back at that. Should we just do that?
Yeah. So those things, yes, they can be related. Is everybody good?
Yeah, we're good. I'm crying a little.
I didn't know this was comedy hour. I love it.
Okay,
those 2 things can totally be related. Yes.
Between the bladder situation and the running and jumping situation.
Correct. So most of the patients that come to see us are coming because of pain with intercourse, or they're having bladder leakage when they're jumping on the trampoline, or urinary urgency or frequency. And most of the time what we find is that these patients' pelvic floor muscles are not low tone. They're not weak because they are not tight. They're weak because they're too tight. So Sarah, you know this, every muscle has an ideal resting tone. Mm-hmm. And so most of the time our goal with PP or pelvic floor PT is getting those muscles back to their optimal resting tone and then translating that into whatever activity or functional thing that you want to do without leaking. It usually boils down to, again, muscles that are too tight. So those things go hand in hand. The urinary urgency and frequency that Caleigh experiences between episodes is probably because her pelvic floor musculature is higher tone. And then the jumping on the trampoline, the running, that stuff just has to do with pressure management. So, are you able to stabilize through your core with a functional activity like running or jumping, which can often be literally a matter of stacking your ribs over your, it's very small changes in your posture, in your body that can allow you to do these things without peeing your pants.
Were you listening to the episode that we just recorded? Because I'm not kidding. Everything that Nick just talked about, you just said in like the last 2 sentences.
Yeah.
Which is crazy. I'm like, that's awesome. And it was like a guy, he was sitting here. He's military. He's very decorated, athlete and coach, and he's got a ton of experience. And he was just talking about the stabilization, core health, all the fun things. So what would be something that would contribute to having a tight pelvic floor? Typically, is there anything typical?
Well, I mean, speaking specifically in terms of Caleigh, sometimes that anxiety component, that vagus nerve turns on and we're in fight or flight.
I'm constantly
and that can kind of
in an
increase
anxious fight or flight
Yep.
state.
Exactly.
That's just part of her personality.
I have
I
anxiety.
mean, but a lot of us are anxious, right? Like this again is just really good information, so people don't feel like they're alone with this. Like anxiety in general can lead to an increase in tension or tone of the pelvic floor. Sarah, what was your question?
Well, yeah, that was my question. You know, like what would attribute or be a possible cause of something that stayed
tangent. Yes. So as women also, you know, the diaphragm, which is kind of like a dome-shaped muscle that sits under our lungs, moves in synergy with our pelvic floor, which means like when we take a breath in, that diaphragm moves down. And our pelvic floor should move down as well. But our abdomen should also move out. Our ribs should expand. Our back should expand to kind of make room for all of that. And as women, I mean, correct me if I'm wrong, but I've been told my whole life to take up less space. I've been told to be smaller, suck it in, you know? And so we start sucking our guts in, and then our ribs flare, and we are no longer operating in this synergistic pattern of pelvic floor moving with diaphragm. Now our pelvic floor it's stuck.
So it's the patriarchy's fault, really.
Yeah.
Well, there we go. We just solved all the problems. Thanks, Stefanie. That's been great. We just got the answer we needed. Like, we're good now.
Down with the patriarchy. Stefanie, I do have a question about Kegels, because you always hear that's how you fix all this. That's how you tighten up. That's how you.
Yeah.
Is that? But I've also read recently that like that's kind of a maybe not the information. Dated.
Yeah, dated. Yes. You know, Kegels are great, right? Like that's how we contract pelvic floor, but it's not the end all be all.
Right.
And the truth of the matter is 90% of the people that walk into my clinic don't know how to contract their pelvic floor. So now you're telling women to contract this muscle group that they have no idea how to fire or release. What, you know, so now we're just squeezing our butts and we're squeezing our inner thighs and we're substituting. So we're not actually kegling.
Now you're making me question if I actually know.
Do you do Kegels?
From time to time.
You do?
I do them at the red lights.
No.
Are you supposed to do them seated?
I heard that one time.
You know what? No, I mean, that's really great. That's totally, absolutely the advice that people give you. Yes, but please stop doing your Kegels at red lights if you do not know how to Kegel. Is that fair?
Yes.
I'll accept that.
You've not properly been taught how to Kegel?
I have not properly been taught. I just always thought.
Do you know what I purchased, but I have not yet used?
Tell me.
Those weights.
Okay.
I don't know why, if I need them, but like you talked about them at one point.
Yeah.
Yeah. And so like, that's something that people are like pelvic floor people talk about, but I don't know if it's relevant for what I'm dealing with. Kaylee's looking very confused about what the weights are that I'm referring to.
Like,
weights
you need to go into what you're dealing with. This seems like maybe you should just come see me in Lincoln.
Like make an appointment.
We might have to. You might have to come see me.
Just like weights for your vagina.
Yeah.
The Kegel weights are great if that is what your pelvic floor needs.
That's true.
But if you are a high resting tone person and you don't need to be contracting your pelvic floor all day, every day, because that's what it does. This group of muscles is on all day, every day. Literally is the basement of our pelvis. Like it is holding up our internal organs. It is under voluntary and involuntary control, and it doesn't shut off. So if you have trouble quieting that muscle group already, then you probably don't need Kegel weights to fix whatever problem it is that you think that you need to fix. And I will say that with the caveat of please don't throw your Kegel weights away until you've been assessed by a professional who knows what they're doing.
Oh, I love it when disclaimers get added. Right? Yeah. Yeah. No, that's good because it's like I saw them and they kept popping up and I was like, Stefanie talked about these. I wonder if I would need these. And then I bought them, but I have not put them to use yet. So now I think maybe I just need to come see you and we'll have to figure out Stefanie
plan in action.
said
Let's
it.
do it.
Right, yeah. Caleigh is looking so confused to me right now. Like she just cannot
I'm
put
picturing
together.
all sorts of. What are Kegel weights?
They're a weight that goes inside of the vagina, Caleigh, and the theory behind it is that you can do so many more Kegels with them in than just contracting on your own. So
Okay.
More bang for your buck.
See, there you go. More bang for your buck. So there you go. Because you're holding everything in. So,
All right.
I mean, I'm sure there's probably a variety of different things that you would work on a patient or work with a patient on based on where they're at. But what is something that you're looking at that you can do? Just see a professional and get assessed correctly and kind of come up with your own plan. Because there are ways that you can run without peeing your pants.
Absolutely.
Without surgery.
I mean, pelvic floor PT is a non-pharmacological, non-surgical approach to helping you understand and manage all of your symptoms. So yeah, there's a lot that you can do. And I think, I don't remember if we talked about this last time, Sarah, but like there's a lot that you can do even if surgery has been advised. So like just evaluation process in general, like is that what you're...
Well, yeah, I mean, and for just people to know that it might be common, but it's not normal. That you don't have to live with it. If it's something that you want to correct, that there are options to correct it. It's not just something where you're like, well, I just have to wear a pad every day.
No, you do not have to settle for that if you don't want to. And I appreciate that you acknowledge that sometimes people are okay with leaking. Like, you do you, right? But if you have an issue with leaking or frequency or urgency, and this is not just bowel, this could be bladder urgency, or I'm sorry, not just bladder, but this could be bowel urgency and bowel frequency. My moms that have had 3rd, 4th degree episiotomies or tears, we giggle about grandma walking around with the walking parts, right? But like, this is something that we can help with. You don't have to live with this if you don't want to. There are solutions that are very practical. Most of our patients, we start with literally their exercises are breathing. Like we just take it back to the very, very basics of getting back to expanding the muscles that are supposed to expand when we breathe and contracting the muscles that are supposed to contract when we exhale.
And I think a common misconception is that you're only dealing with these issues if you've had children.
Absolutely not.
This applies to youth, women, and men.
Across the board, yes. So your kiddos that are maybe nighttime bedwetters, they could be constipated. That could be the thing that's driving their nighttime, their inability to be dry overnight. And age appropriate. My partner, Jamie, she sees the pediatrics in the clinic. So I'm going to be real honest with you. I don't know what that age is. I know there is a very distinct difference between daytime and nighttime continence. So, if your 3-year-old's still wetting through the night, like don't panic, right? They're not constipated. They might be, but...
What if my 5-year-old is?
My 4.5-year-old is. So
some of them take a while to work through it all.
All right.
But yeah, men have pelvic floor dysfunction that can present in erectile dysfunction, premature ejaculation, pain with erection, pain after ejaculation, constipation with men as well, men that have had prostatectomies. And then, women, even if you haven't had children, sex shouldn't hurt unless you want it to. That's a whole different ball game that I don't deal with, but it shouldn't be painful.
Yeah.
Even the first time that you have intercourse, even after you've had a baby, it shouldn't hurt. So there's, a whole host of things that we can address as pelvic floor PT.
Well, yeah, and there was a 8-hour continuing education course I did on pelvic floor and core health, and she talked about youth gymnasts, things like that, things that...
Gymnasts, cross-country runners.
Yep. Yeah. Running, jumping, all the things that are putting a tremendous amount of pressure on that. So, I think that's a great message for people to know and understand that it's common, but you have options. So
it is common, but not normal. And you don't have to live with it if you don't want to live with it.
So seek out a qualified healthcare professional to help you in this area.
All right,
if you're
Stefanie,
local.
hang on the line. We'll make an appointment.
I've got my thoughts.
Caleigh and I are road tripping.
Don't make me promises.
We're gonna
Don't be making me empty promises over there.
We're gonna go do a bar class.
we're gonna come see you, and then we'll go down the road and we'll do our bar class, and then we'll just make a day of it. So
Are you guys saying bar like BARRE?
Yeah.
Stripper
Yeah.
pole class in Lincoln. So are you guys like disguising the stripper pole class as your bar class?
No, but those classes are equally difficult.
Yeah, we
That's
had
no joke.
We had a guest on earlier in the season who is a bar instructor, and we vowed to go.
Episode 1 actually is when we talked to her, and so she gave us some education on bar instruction, and we were like, maybe we should try a class.
Yeah,
So-
do it. It's fun. Is
But-
it Pure Bar?
Yeah. No, wait, beyond bar.
A bar above.
A bar above. Oh, there's
a bar
too
above.
many. There's way too many. Okay, I can't keep
So
track.
many options.
But I think we need to add the stripper pole class to our list of topics, though,
For
because
sure.
that's a
But
legit
only
workout.
If I can
Yeah.
come, okay?
It's intense.
Yeah.
A lot. So
You want to come to the stripper pole class or the bar class?
Yeah. No, I've been to a
All of
bar
it.
class. I mean, I've been to a stripper pole class.
Not
Cut
all
that
of
out
us.
of there.
that's fine. We'll just add them all to the list. We're gonna start making the rounds.
Make a
We're
road.
gonna bring our friends with us, and here we go. So awesome. Well, you know what, Stefanie, I appreciate your expertise in this topic. I think it is super important for people to know and hear and learn more about. And so thank you. We'll include how can people find you? I guess let's do that first.
Yeah, so you can find us online at empowerptlincoln.com. We are on Instagram at empowerpt_LNK. And same tag for Facebook. Sarah, help me, please.
Yeah. Well,
Same handle. There we go.
Yeah, the handle. Yeah, we'll add your links into the show note, but I think it'll be good for people to kind of hear too that, you know, they can find you if they're interested in getting a hold of you, or if they're not geographically close, then, you know, they can seek out a qualified health care professional in their area that specializes in this.
Yes,
So
and you guys, you've got somebody in town that is beefing up her pelvic floor game as well. So check
awesome.
her out.
Yeah.
Carly Hawkins. She's amazing. So
very cool. I love it. So thank you. Well, you know, we might come up with more questions for you. We'll have you back, but we appreciate your time for sure tonight. So
much for the opportunity to come talk to you. It's a pleasure. So.
yes. So thank you so much again.
Thanks, Stephanie.
We'll chat with you soon. So,
Bye.
all right. Thanks.
Bye.
Bye. All right. So, Caleigh, what do you think about this topic?
It's great.
You love it or
I
hate
felt
it?
very attacked. You know,
You should not feel
Felt very-
attacked. It was just a topic of conversation.
we're trying to help you.
We're just trying to help. See, this is why
No, it was
people
great.
get nervous and scared to actually like try to help friends,
Yeah.
because then you take it personally.
Right.
Don't take it personally.
Yeah.
I'm just trying to give you the knowledge that you would need to make your own informed decision.
As I would do for you.
Thank you. I appreciate that.
I feel like I caught you off guard there.
Yeah, you did. I was like, oh, I don't even have anything to say about that, but thanks. So appreciate it. But awesome. Well, thank you. So yeah, I think this is a great topic.
Yeah.
I'm so glad she was able to join us, and I'm sure I would love to hear people's questions, comments about
Yeah,
it. though,
because I
for
think
sure.
it is a common problem.
It is a
It
common.
doesn't have to be a normal
Yep, that's right.
problem.
We'll just leave it with that. So
Yep.
until next time.
Bye.
Thanks for listening. Be sure to head over to our Instagram at Nacho Fitness Coach and let us know how you feel about the topic. Do you love it or hate it?
Also, don't forget to hit that subscribe or follow button wherever you're listening. And if you like our podcast, leave us a rating. See you next time.
You've been listening to Euphony Innovatives Sonified.
Thanks for listening. Be sure to head over to our Instagram at Nacho Fitness Coach and let us know how you feel about the topic. Do you love it or hate it?
Also, don't forget to hit that subscribe or follow button wherever you're listening. And if you like our podcast, leave us a rating. See you next time.
You've been listening to Euphony Innovatives Sonified.